Good evening, doctors, embryologists, ladies and gentlemen, and a very warm welcome to today's MSART second webinar. And the topic for today is sperm DNA fragmentation and ART success. We know that this sperm DNA fragmentation is closely related to embryo development and also with poor implantation as well as recurrent miscarriages. And the knowledge of this DNA fragmentation has been there for a long time. And the test has been available for more than 40 years. My practice about 30 years, I seldom use this DNA fragmentation. Maybe after this lecture, we may start to think differently or see this DNA fragmentation from a different aspect. And for today's topic, we are very fortunate to have an expert in this sperm DNA fragmentation and an expert in male solutions. And she is Miss Cherry Yang from Taiwan. Just to share with you, for those who may not have known her, Cherry Yang spent more than 20 years working in the medical field, including 7 years experience in male infertility. Her expertise is to guide and train new AI technology implementation in IVF andrology laboratory around the world. She was invited as international speaker for the American Society of Andrology to 2023 and introduced how AI could help ART in male perspective point of view. Now, Cherry received her master's degree of science in marketing from University of East Anglia, UK, 2004. After graduation, she worked in the IT industry during the boom of the AI technology. Therefore, she devoted herself to find out the unmet needs in the medical field, which might have highly possibility of a solution by AI technology. In 2017, she joined Bonraybio company, a leading company focused on male infertility total solution and responsible for product development, marketing, and training of the global andrology IVF lab. Welcome, Cherry Yang. The floor is yours.
Okay, thank you so much, Dr. T. So today is my pleasure to give you the talk about the sperm DNA fragmentation versus ART success rate. So let me share the screen right now. Okay. So we all know that the spermatozoa with genetic material which we call chromosome in its head. And one of the chromosome make up a long condensed DNA macular. And if we all know that the DNA consists by 2 different strands. So if there is one strand break, then we call it single strand break. However, if both strand break, we call it double strand break. But no matter single strand break or double strand break, we all call it sperm DNA fragmentation. So what kind of patient have the highly possibility to cause this high level of sperm DNA fragmentation? If your patient belongs to a heavy cigarette smoker, or he got a highly potential in the environmental toxin area, or he has the issue of testicular hyperthermia. For example, he like to take a very hot bath, or his job is the chef, or he has the some sexual dysfunction issues, so he cannot so he has the infrequent ejaculation issues, or he got the varicocele, or he has the genital tract inflammation, or he got the hormone factors, or he has the cancer, so he need to take some special drug, or chemotherapy, or even the radiation therapy. And of course, if his age is pretty old, that might be another group which has the high sperm DNA fragmentation issues. And what if the sperm DNA fragmentation is high? According to a lot of journals, it says the high level of DNA fragmentation, it will easy to impact on the fertilization rate. That means the sperm might cannot be penetrated through the egg to let it become the zygote. Or even it can become the zygote, it cannot be held tightly by the uterus. So it will impact on the implantation rate. And it will easy to increase the miscarriage rate. We have a lot of experience even when you transfer the embryo, the zygote, into the uterus, but it cannot hold a baby until to the end of the pregnancy journey. And we also found if the double-strand break level is pretty high, it will have another more serious issues, because these couples, this woman might have the recurrent pregnancy loss. So because of that, the updated EAU guideline, which is published in 2022, it says the sperm DNA damage is more common in infertile men, and the sperm DNA damage has been identified as a major contributor to male infertility. And also in the updated WHO guideline, which is published in 2021, it also says the high level of DNA fragmentation will affect the embryo development and implantation, and also the pregnancy rate in both nature and assisted reproduction. So maybe your couples have the issues to have the baby by natural way, but high level of DNA fragmentation will also affect the ART success rate. And we all know that there has 4 different methods to do the DNA fragmentation. One is tunnel, the other is SCD, and the third one is COMET, and also the SCSA. And the method principle of tunnel, we use the zymatic reaction. So if you use this kind of methods to examine the DNA, then you need to use the fluorescence together with the microscope, or you could use the flow cytometry. And when you put the reagent into the semen sample, if the cell turn in green, that means this sperm got the DNA fragmentation issues. Otherwise, it should be normal. And SCD methods, the methods principle is more like DNA susceptibility to acid denature. So if you put the reagent into the semen sample, then if the cell have the big halo, that means this cell got the normal DNA. If it has no halo like this one, that means this sperm got the DNA fragmentation issues. So you need to use the bright field microscope to examine the halo size to decide if this sperm belongs to normal or abnormal. And the third one, we call it COMET. And the method of COMET is the DNA migratory ability. And by use this kind of methods, you need to examine the tail of the cell. So you need to use the fluorescence microscope, and sometimes you also need to use the software to calculate the length of the tail. So if there has the tail, got the tail, that means the sperm got the DNA fragmentation issues. Otherwise, it should be normal. And if the tail is longer, then that means the DNA damage situation is more seriously. And SCSA, the method principle is selective intercalculation of AO dye. And the same, it is pretty similar like tunnel. You need to put the reagent into the semen sample and then use the fluorescence microscope to get over the flow cytometry to examine the cell. If the cell in green, that means that is the normal, otherwise it is abnormal. And we all know that both of this method are all belongs to the general cell. Only SCD is dedicated for sperm because we could distinguish if these cells is sperm or not, because we could use bright field microscope to check if it got the tail or not. Otherwise, if you use tunnel, comet, and SCSA, if your sample have the WBC issues or it has the red cell inside the sample, it will be easy to to become the population to do the sperm DNA fragmentation calculation. And actually, each kind of method has its own advantage and disadvantage. And for SCD, the advantage is it is very simple test. So according to this article, it says if you are the new one, want to learn how to do the sperm DNA fragmentation test, then SCD methods might be the good methods for you to start with. However, the disadvantage of this method has the high inter-observer viability. So we want to know why it will cause the inter-observer viability. Because as we know that most of lab, they still not to do the DNA fragmentation test. So they should be the new one to start with this kind of test. So according to the journal said that SCD is the best way for you to learn how to do that. So we want to overcome the disadvantage. And we find the reason to cause this kind of disadvantage is because the unclear image. If the halo size is not correct, then the result will be not correct. But if the halo is not clear, then that means it will be very easy to make the wrong judgment. So the unclear image is one of the reasons to cause the high inter-observer viability. And secondly, it has the highly subjective issues. We know that if you use the tunnel as CSA, you could use flow cytometry. So that means you have your software to help you to do the calculation, or even you use Comet, you could use the software to do the calculation as well. However, SCD nowadays only could calculate by manual. So manual issues still exist in SCD method. And because you could only calculate by manual, so the low number of sperm examination is another issue to cause the inter-observer viability. Because if you rely on manual calculation, the maximum sperm count is around 300 to 500. But if you use the flow cytometry, the sample size could be 1,000. So that is a huge different sample size. So how AI-based technology could assess the sperm DNA fragmentation test? The first step when we develop the products, we want to ensure that we could provide you a very clear image. So because of that, we not only to develop our own algorithm, but we also provide you our own reagent. We call it LabIVF R10. So inside this package, you could find the lysis and DNA denature and 2 bottles of the stain solution together with 10 pieces of the pretreatment slide. And how we could guarantee the clear image, because we use our patent technology, we call it inkjet denature. If you want to use SCD, you need to follow 4 different steps. The first step is embedded, which means you need to fix the sperm inside the egress. And after that, you need to denature. That means you need to separate the DNA strand into one single strand. And after that, you need to lysis it to let the DNA loop release. So if the DNA is normal, then the loop will be bigger. And after that, when you put the staining solution on top of the sperm head, then you will make a perfect halo. And because we have already improved our step to combine the embedded and denature step, so we could provide you more clear standing image. And it is very easy. All you have to do is mix the agarose with DNA denature together with semen sample. And after that, apply the sample on top of our pretreatment slide. And then you need to lysis it and then stand it. So the step will be very easy. And also the image is very clear. So from the image, you could see that if you use the traditional SCD, the halo is quite blurred, and also the core is not very clear. So for this kind of calculation, it will be very easy to make the mistakes. And also the background is very dirty. So you can even know where is the boundary of the halo. However, if you use our improved SCD, the halo is pretty clear, and the core is very solid. So you could distinguish the halo size very precisely. And also the background is very clean, so it will not get the dirty background to affect your calculation. And because of that, we could reduce the whole examination time from 75 to only 40 minutes. And the second step is we want to reduce the manual subjective issues. If you want to calculate the DNA fragmentation issues, the first step, you need to decide if that belongs to sperm or not. If it belongs to sperm, then you could calculate the halo width. If the halo width longer, bigger than the sperm cord, that means it is the big halo. We call it large halo. If the halo width smaller than the sperm cord, however, still bigger than 1/3 of sperm cord, that means this kind of halo belongs to medium. However, if the halo smaller than 1/3 of the sperm cord, that belongs to small halo. If there is no halo, that is another fragment type or degraded. If you see the core is not regular, that means that is degraded. So large halo and medium halo belongs to normal DNA. However, sperm halo, no halo, or degraded belongs to fragment. So the DF5 formula is very easy. You could calculate the number of the sperm with fragment DNA divided by the number that you count and multiply 100%. So for example, if you count 500 sperm and you classify large halo for 200, medium halo 200, small halo 55, no halo 25, degraded 20. So the DFI value should be 55 plus 25 plus 20 equal to 100. So you will get the DFI around 20%. So that is the way to do the calculation for the sperm DNA fragmentation. However, it is very subjective, especially for the medium and small halo, because many people will easy to confuse about these two halo. And also, if you want really to measure the size, you need to calculate for each sperm. But usually manual don't do that. They will depend on their thinking. So that's the reason why the result will be very easy to operate by the different operator, because they all got the different judgment. And now we know the AI generation is coming. Actually, AI is not just coming this year, recently. It is start from 1950. But in 1950, that kind of AI is more like criteria for judgment. In that kind of generation, we provide the machine what is wrong or what is right, so that they based on this kind of criteria to make the judgment. So that kind of judgment is easy to make the mistakes. However, from 1990, the machine learning appeared. At that moment, we use the database to training the machine to learn. So in this kind of methods, then the AI become more and more smarter. And in 2010, deep learning boomed the OAI. So a lot of applications start from this year. And deep learning means the machine could learn by itself. So not only for medical field, but also for a lot of consumable market, a lot of people start to use the AI to develop the software or even the algorithm. But you might be curious, what is machine learning and what is deep learning? Because both of them seems could learning by itself. So if you use the machine learning, both of them need to put the database, to put the image into the database. But if you use the machine learning, you still need to rely on manual to do the feature injection. And then based on this feature injection, then the algorithm to do the classification by itself. And based on that, it could help you to distinguish the sperm and not sperm. However, if you do the deep learning, all you have to do is provide a lot of database into the machine, and the machine will do the feature injection together with the classification by itself. And after that, it will provide the result. And I would like to use the two kind of animal as the illustration. So dog and cat, both of the animal got 2 eyes, 2 ears, 1 nose, 1 head, 1 body, 4 feet, and 1 tail. If we only use this kind of features to distinguish, it is not easy to distinguish dog and cat. But if we could also highlight the feature of the color of the eyes or the shape of the ears, etc., then it will be easy to make the distinguish. So, but if you use the manual to highlight the features, we still got the limitation. However, if you use the machine to highlight the features by itself, it could highlight many differences between dog and cat. So because of this deep learning, then the AI technology become more and more popular. And we use deep learning to create the algorithm for not only for sperm DNA fragmentation, but also for the genome semen analysis. So our R10 reagent not only could allow for manual examination, but we also provide you the Lancewood X12 Pro semen analysis to help you to do the calculation automatically. So Lancewood has the fully solution, not only for the reagent, but also provide you the machine to do the auto calculation. So how this machine work? First of all, if you put the slide into the platform, then it will autofocus. So if the machine detect the focus is clear enough, then it will take the picture, it will do the image capture. And after that, the machine will recognize which kind of parameter that you request it to do the examination. So for example, if you put the slide into this machine, it will detect, oh, you want me to do the DNA fragmentation, so it will start the algorithm to do the calculation. And after that, it will do the image segmentation. So it will separate into several different segmentation, and then it will select the image. So for example, if this image is not normal, for example, this kind of image is not easy to make the judgment, so it won't calculate. However, if it belongs to normal, then it will calculate. And after that, it will do the calculation. So for example, the first step, it will distinguish if it belongs to sperm or not sperm. If it belongs to sperm, then it will classify the halo size. If it belongs to a big or small or medium, or it belongs to small, no halo or degraded, to decide the normal sperm count, normal DNA fragmentation sperm count, then you could get the DFI value. And the third one, we simplify the whole operation procedure because we know more step means more possibility to make the mistakes. So when we create this machine, we want to make as easy as possible. So all you have to do is put the slide into this machine, and then the platform moves the slide into this machine, and everything will fully automatic by this machine. And then you could read the report. So only 3 steps takes you around 3 to 6 minutes, then you could get the result. And it also could enlarge the sample size. As I said, that if you do the calculation by manual, it could only calculate for 3 or 500. However, now we use the machine, so we could calculate the whole slide. So that means it could allow to calculate the sample size more than 3,000. So let's see the performance of our lens hook DNA fragmentation total solution. Actually, we got our own publication in 2023. According to this publication, it compared our improved SCD, I mean the reagent, with the traditional SCD, we call it G2. And according to the result, you could see the correlation could reach to 0.85. So it shows a high correlation. And also, we want to validate if our algorithm is correct or not correct. So we put the R10 slide read by manual and also read by our machine. And from the correlation, you could see that the correlation could reach to 0.9. So that means our algorithm could make a very precise or accurate judgment compared with the manual examination. So according to the result, that the high agree improved SCD DFI between the manual interpretation and the AI SCD. And the third one, we also compare our lens hook X12 Pro together with R10 and compare with the result by SCSA. And from the result, you could see the correlation could reach to 0.9. And in patient Bob log regression, there was no significant deviation from the linearity between the percentage of DFI by AI-SCD and SCSA. And we all want to know if there is any inter-observer agreement, because as I said that SCD, the disadvantage is it has the high inter-observer viability. So we use 10 different samples and ask for different observers to process the sense burn and to read the DNA fragmentation slide. And according to the traditional SCD, we call it G2, the CV will reach to 25. However, if you use our R10 slide, because we improve the image to make the clear image, then you could reduce the CV from 25 to only 19. However, if you use the machine operated by 4 different operators, the result will reduce only to 4%. So that means if you use our R10 slide together with X12 Pro, our machine, that could guarantee you that no matter who use the machine to read the slide, the result will be always similar. And let's see the comparison between the traditional SCD and AI SCD. We call it lens hook solution. So the first one, counting halo. If you use the traditional way, you need to count by manual. However, if you use a lens hook solution, then it have the automatic solution. And the standing solution, if you use the traditional one, it is blurred. However, if you use the AI SCD, it is more clear. And standing time, it takes around 70%, but AI SCD, it only takes you around 40 minutes. And for the calculation, it is, if you calculate by manual, it takes 15 minutes. However, if you use AI SCD, only takes you 3 to 6 minutes. And the average sperm count, if you use traditional SCD, you need to count around 300. However, if you use AI SCD, you could reach to more than 3,000. And inter-observer viability, if you use traditional SCD, it is pretty high. However, if you use AI SCD, it is low. And we still got a lot of different features about this machine. First of all, it could provide you a very professional PDF report. If you use the manual way to do the calculation, you could not get the classification like that. All you could do is to collect the fragment, the percentage of the DNA fragmentation level. However, if you use our lens hook machine, then you will get a very perfect PDF report for your patient. And our machine could allow you to use the barcode scanner to scan the patient's barcode, so that could prevent some manual typo issue. And if you want to review by the big monitor, that is possible. You could connect this machine with the big monitor by HDMI cable. And if doctor want to read the paper or read the report, they don't need you to print out the report and send it to his clinic. He could use his computer and access into this machine by the LAN connection. So once you finish the test, doctor could access into this machine to read the report immediately. And this machine can not only detect the R10, the DNA fragmentation, but also it could test the general semen analysis. For example, it could help you to get the concentration, motility, and also morphology. And this is our machine.
LensHook, the professional of semen analysis, will provide you with a totally new experience of examination. It not only offers you the fully automatic exam system, but also the new formula reagent. LensHook R10 develops the innovative in-gel denature technology to reduce 40% test time from 75 minutes to 40 minutes. In addition, the new reagent allows you to make the incredible sense of clarity of sperm's halo and core to reduce the subjective issue compared to manual examination. LensHook X12 Pro supports 4 USB ports, 1 HDMI port, and 1 Ethernet port to allow you to connect the barcode scanner, HD monitor, and the LAN. This machine is compact, light, and only takes you 3 to 6 minutes to complete 1 sample examination. The automatic XY table helps to move the slide to take photos for the different fields. LensHook X12 Pro allows examination of multiple fields. The professional report provides a lot of detailed information for diagnosis. LensHook, the total solution of sperm DNA fragmentation, will bring you to the new generation for semen analysis. Bonraybio technology inside.
And we all know that some of the customer will ask, what if we do the DNA fragmentation and find the patient got the high-level DNA fragmentation issues? And the answer will be, you need to treat it. You need to treat him. So some of the IVF, they will send this kind of patients to the andrology clinic for further treatment. Or if the patient got an age, they cannot treat anymore, they want to have a baby immediately, then you need to use the correct way to process the sperm. However, we found if the poor sperm wash method will also easy to increase the sperm DNA fragmentation levels. And according to WHO, there have 3 different methods to process the sperm, which is simple wash, direct swing up, and density gradient. However, 3 of the methods all need to use the centrifugation, and we all know that the centrifugation will easy to increase the DNA fragmentation. So according to this article, it says, if you use the density gradient, it will increase the DNA fragmentation, and it will reduce 50% pregnancy rate. So that means if you use the wrong methods to process sperm, sometimes you will damage the DNA, you will damage the sperm DNA. And why it would damage the DNA? Because if you span the sperm, it will easy to increase the reactive oxygen species and reduce the antioxidants. That means you increase the bad material and reduce the good material. So this kind of situation is easy to increase the oxidative stress. So oxidative stress will increase the sperm DNA fragmentation levels. And many people will say, I don't need to worry because our clinic 100% processed by ICSI. However, from this article, it says, if you process by ICSI, then it will impact the fertilization rate as well. No. It will impact on a lot of different ways. So they use two different groups. One is by density gradient, the other is by direct swing up without centrifugation. However, they check the fertilization rate, the direct swing up, the density gradient, the fertilization rate is around 76%. Compared with a non-centrifugation direct swing up, it is around 81%. So that seems that makes no big difference, right? However, when they still to monitor the prostitution rate for the day one, that start have the difference. Because if you use the non-centrifugation, the prostitution rate will if you use the density gradient, the prostitution rate will be 41%. However, if you use the non-centrifugation, it could remain on 58%. And let's see the prostitution rate in day 3, the number will much higher than density gradient. And in the end, the pregnancy rate, if you process by non-centrifugation, it could still remain on 41%. However, if you use density gradient, it will reduce only 25%. So ICSI is not the best way, or is not the only way to do the sperm DNA fragmentation treatment. So because of that, the centrifugation-free becomes the trend. So more and more methods appear on in the market. So current centrifugation-free, we could divide it into 3 different methods. One, we call it MAX. So the idea of the MAX is put the magnetic along the tube. And they over the reagent, and inside the reagent, they have the magnetic substance. And on the substance, they cover by annexin 5. And we all know that annexin 5 is a kind of protein. And this kind of protein will bind in the PS. And this kind of PS material is easy to be found from the abducted cells. So if the cells is immature, it belongs to abducted, then it will be attached by the magnetic ball, and then it will be attached along the wall. Only could allow the mature sperm fall down to the bottom. However, this kind of methods cannot distinguish the immotile sperm because they could only help you to select the mature and the immature sperm. And there has no sufficient literature support. And the second one is very popular recently. We call it microfluidic. The idea of the microfluidic is they provide a very tiny channels to allow the sperm to swim and change the direction to their destination. So from the chamber A, you need to put the semen, but from B, C, D, you need to put the median. And when you put the semen sample here, then only the motile sperm could change the direction to the chamber C. And if the sperm without the motility, it will be pushed to the chamber D. And this kind of methods got its disadvantage because the channel is very tiny. So it is easy to stuck by debris. So that means if your sample very dirty and you want to process by microfluidic, you need to pre-wash the sample. Otherwise, you cannot use that. So that means if your sample concentration is not good enough, that might be an issue to use the microfluidic devices. And now the third one, we call it live motile sorting. And this technology is divided by us, and we call it Landswork CA0. And the idea of live motile sorting is because we provide the environment similar like the female vagina. We know that the sperm swing inside the vagina, they never swing directly up. They are more like the salmon swim to the upper stream. So when you observe the sperm swing inside the vagina, they will touch the wall of the vagina and crawl to the up. and to reach to the egg. So we design this kind of environment, design this kind of wall to provide the motile sperm the support, which could allow them to move to the upper layer. And after that, they could penetrate through the pore to the median. And there still got some advantage of our lens with CA0. The first one, it is very simple and it is very fast, and it could guarantee you the excellent performance. And we know that if you use the density gradient, the process is very complicated. So you need to use the centrifugation for 3 times and then resuspend it. So, you know, if you process by centrifugation so many times, each time's got you the highly possibility to increase the DNA fragmentation and also easy to make the mistakes. However, if you use lens with CA0, it is super easy. Add a sample and then add the medium, put the devices into the incubator, and then collect the sample. I would like to use the video to let you see how easy it is. First step, you need to remove the cover. Then also remove the motor. You will see the base. Then you need to add 1 ml sample to the base. That you need to put the filter base. Make sure that the filter is on quickly. After that, you need to apply 900 HPF up from the pool and then on top. Devices to the incubator. And have it could collect around 500 sperm. So that is very easy. And also it is very fast because we double size the dimension of the tube. So it could allow the sperm penetrate through the membranes at the same time. So because of that, we could reduce the process time from 60 to only 30 minutes. And we also could guarantee you the excellent performance because we don't use the centrifugation. So from the video, you could see we use the same sample and process by 4 different methods. And according to the video, you could see the sperm from our technology all swim very fast. And who should use CA0? Of course, we will encourage you to use CA0 for every patient. But if that is the issue, you still want to use density gradient, who will be the best group to use that? The first one, if he got the high sperm DNA fragmentation issues, of course, you need to use the devices to reduce the DFI value. And also, if the age is old, I mean, if the couple age is old, then there will be another group to use CA0. Or it has a repeat ART failure, then you need to try CA0 to see if you could increase the ART success rate. Or if it has the OAT cases, or even for the frozen sample, because we know if you put the frozen sample, you put the sample into the fridge to freeze it, then it will increase the DNA fragmentation. However, you need to remember, if you use a frozen sample, you need to defrozen sample before you process by CA0. And you also need to check if the concentration is more than 6 million per milliliter and the total motility is more than 20%. However, if you want to process by ESTEEMED, then you need to check if the NIST sample, the motile sperm concentration is higher than 1.7 million per milliliter. And let's see the performance of CA0. According to WHO 6th edition guideline, it says an ideal sperm preparation technique should recover a highly functional sperm population that preserves DNA. So when we do the performance evaluation, we not only evaluate the motility, morphology, the debris removal, and also the DNA fragmentation. And from the publication that just issued last year, it says the CA0 was effective for both normal and abnormal semen sample because it's a consistent selection efficiency. And according to the table, you could see that the total motility for the NIST sample is around 56. After processed by CA0, it could reach to 94. Compared with the other two methods, it is pretty good. And for the progressive one, the same, it could increase from 47 to 90. And rapid one, it could increase from 35 to 83. And for normal morphology, it could increase to 5.5 to 10.3. And for DFI value, it could reduce from 90.5% to only 2.4. And how about the performance of abnormal sample? From this table, you could see that if we process the abnormal sample, the NIST sample is 40, but after process, the motility could reach to 89. And for progressive one, it could increase from 33 to 80. And from rapid, it could reach to 74. For normal morphology, it could increase from 3 to 8.5. For DFI, it could reduce from 13% to only 4. And we also want to guarantee you, no matter who use our CA0 could still have the similar performance. So we do inter-observer agreement. That means we ask 3 operators from junior to senior to process the same sample by DGC and CA0 to see if the result could be similar. So from the CV table that you could see, if the operator processed by live motile sorting, which is our last CA0, the CV will only 17.8%. However, if you process by DGC, the CV will reach to 36%. So that means if you use DGC, you need to make sure that every embryo or every technician could have the similar well-trained experiments to do the DGC. Otherwise, the result will be quite different. However, if you use live motile sorting, the result will be quite similar. And let's see the clinical outcome. Actually, we work with a lot of IVF lab over the world, and some of them are still under the experiment stage. But one of them has already finished their experiments, and now they are working on the manuscript, and they are agree with us to share their preliminary data today. And the objective for their research is to investigate the clinical performance of live motile sperm sorting devices on embryo development. And the clinic name is Reproductive Health Center of Chachava Clinic in Georgia. And this clinic is the biggest IVF center in Georgia. And they have 2 different purposes. The first purpose is to investigate CA0 benefit on embryo development in couples undergoing ICSI cycle. And the second purpose is to compare embryo pallidal status and the clinical outcome between swing up and CA0 in egg donation ICSI cycles. So in total, they did around 140 cases. And the first one, let's see the demographic and cycle characteristic. And from this kind of table, they define two different kind of parameter. One is paternal risk factors. They separated the age for 42. If the age younger than 42, that belongs to normal group. We call it control group. If the age is older than 42 years old, that belongs to advanced male group. So that means this group, the male is older. And we also set up another maternal risk factor. We use M2. If the M2 number is bigger than 11, that means normal. So we set up it as the control group. And if the M2 number is less than 11, that means the female got some poor ovulation response. So they have some issues. So we use this kind of two parameter to see the performance of CA0. And we check three different timeline. One is at 12 hours after ICSI, and they will check the normal fertilization rate. And the second stage is at 70 to 72 hours, and they will check the good embryo rate. And in the third stage, that will be at the day 5, they will check the good blastocyst rate. And according to that, they set up the maternal and the paternal and the maternal factors. And from the paternal, you could see that for the control group and advanced group, the result for fertilization rate, good embryo rate, and good blastocyst rate are almost similar. So that means if you use CA0 for the advanced group, that could guarantee you the performance as the normal group. And let's see the maternal risk factor. If you use CA0 in normal fertilization rate, good embryo rate, and good blastocyst rate, the result will be quite similar like the control group. So that means if you use CA0 for the female issues, you could still have the similar result from the normal group. So the conclusion finding is that we find that CA0 could help you to reduce the paternal and maternal risk factors. And the second stage, the purpose is to compare the embryo plody status and the clinical outcome between the swing up and the CA0 in egg donation ICSI cycle. And they use 37 cycles for direct swing up, and they use 43,000 for CA0. And after that, they use PGTA to check the embryo plody status. And that is the demographic and the cycle characteristic. So from this table, you could see that these two groups also got the similar criteria. Only the total motility, the CA0 got a little bit higher than swing up. And let's see the plody result of embryo under various male factors. So from this table, you could check the euplody rate processed by direct swing up. It could reach to 51%. However, if you use CA0, it could increase to 69%. And we also want to check if we have the similar performance for the old people. So we only check the male age more than 42, and we found that for direct swing up, it could reach the plody rate for 53. But if you use CA0, it could increase to 68. And because we just mentioned that our original group, the motility is higher than swing up, so we want to know if the total motility is under the normal cutoff value, could we still get the similar result? So we evaluate this kind of group and to find that CA0 even got the better performance compared with direct swing up. So the conclusion will be CA0 significantly and consistently improve the embryo euplody rate regardless of the different male factors. And we also want to check if the performance is similar like the other method. For example, Zyma. Zyma is another manufacturer. The concept is pretty similar like CA0. However, we check their publication and find the UPROD rate, the best from their solution could only reach to 42. However, if you use direct, you use CA0, it could reach to 67%. And after that, they also check the clinical outcome after embryo transfer in direct swing up and CA0. And they find the embryo transfer rate for direct swing up could only reach to 68%. However, if you use CA0, it could reach to 79%. And they check after 12 weeks, they want to see if they still have the ongoing pregnancy rate. And we are very happy because if they process by CA0, 93%, they could still keep ongoing pregnancy rate. And miscarriage rate, if you use direct swing up, the miscarriage rate is around 22%. However, if you use CA0, it could reduce to only 7%. So it says that CA0 tends to increase the probability of cycle with transferable process and reduce the miscarriage rate. So conclusion, the DNA fragmentation test become more and more important because it does not only impact the fertilization rate, implementation rate, and also easy to increase the rate of miscarriage. And because of that, the latest EAU guideline and WHO all increased the importance of this parameter. And although tunnel access is the common method to evaluate the cell DNA fragmentation, CDSS is more dedicated for sperm. And the mature AI technology could improve this disadvantage of SCDSS. And the new AI SCDSS LensWork R10 with Extra Pro improve the reagent to get the clear image and also develop the AI machine to help on assessing to get high precision result for sperm DNA fragmentation. And also the current methods DGC to process the sperm is easy to increase the sperm DNA fragmentation. And non-centrifugation methods becomes the trend because it could not only increase the DNA fragmentation, but also could reduce the DNA fragmentation. And the live multi-sorting technology LensWork CA0 support the selection of mature spermatozoa with increased chromatin, better DNA packaging, reduced risk of aneuploidy rate, and increase the brustitis transferable probability, and also reduce the miscarriage rate. Okay, so that is my introduction and my presentation, and thank for your attention today.
Thank you, Ms. Cherry Yang. Wow, that was a wonderful lecture you gave. It give what I call an opening for us to see how this sperm what called DNA fragmentation can be used to analyze the sperm quality all the while when using the conventional semen analysis, and allow us to also take advantage of it. And you have also the technology to separate the sperm that is able to produce lower what I call failure, what I call better blastocyst rate, less miscarriage. Yeah.
Yes.
Now we are coming to the Q&A session, and if you all have any questions, please type them in the box, and I'm sure Cherry Yang will enlighten us whatever we need to know. Now, in the box here, we have here, the first question here we have is, what kind of patient do you recommend to do the sperm DNA fragmentation test? Is it possible that the sperm has good concentration, motility, morphology, but high DFI. That means those that have good semen analysis quality, but the DFI is abnormal.
Okay. The first question, I think, if your patient belongs to, I mean, the male patient, the age is pretty old, or if his job, if, for example, if he also need to take, he also used to take a hot bath, or his job is chef, he need to under some pretty hot environment, or he got the varicocele issues, or he need to take some drug, he has the cancer, need to do the chemotherapy. This kind of patients, we all recommend you to do the DNA fragmentation. However, according to the feedback from the market, we find more and more normal patients, they got no issue about the concentration, motility, morphology, but still cannot work for the ART success rate. So in the end, they check the sperm DNA fragmentation and found it got a very high DNA fragmentation level. So that doesn't mean if the patient got a very normal semen analysis, they don't have the DNA fragmentation issues. So you need to double check.
Would you suggest that for sperm analysis, we should run 2 tests concurrently for all?
No, yeah, I think more and more countries, they are not only do the sperm analysis, but they also add one more sperm DNA fragmentation test, because they found if they even do the semen analysis and the sample is normal, but the DFI value is still high. So they always use the combination examination. But if that is not possible for your IVF lab, then they will check some data from the patients. For example, they will ask his behavior, if he is the heavy smoker, or his job, or his age, and to consider if this kind of patient needs to do the DNA fragmentation test.
Thank you. Now the next question is, can it be used for sperm samples from retrograde collection?
What kind of collection? I'm sorry, I can't.
Retrograde collection, I believe, is where the sperm could have gone into the bladder and then retrograde ejaculation, and then from the urine, then you collect the sperm.
Okay. That is possible, because if you collect the sperm from the urine and you want to process by our CA0, all you need to do is follow our protocol. It could also select the sperm.
Thank you. The next question is, I have a question. Let's say the patient's first IVF cycle shows no embryo on day 3 or 4. That means no embryo development. Then we do the SDF test. However, the DFI is only 9 to 10, which actually means it's excellent. Do you have other tests to further assess the problem of the sperm?
Okay, so you mean that they assess every kind of parameter, for example, the DNA fragmentation together with the semen analysis, but in the end, they cannot have the successful ART treatment, right?
Yes.
So
in other words, apart from the normal semen test or DFI test, do you have any other option or alternative for this no day 3 or day 5 embryo?
Okay, maybe they could also double check with the double strand break, because now we got the DNA fragmentation test, so we could detect the single strand break together with double strand break. So if that is the lower the cutoff value, that should be no issue, right? But if most of the fragment belongs to double strand break, that means this kind of sperm might have another issue. So maybe they could consider to only check the double strand break And as I know that there has some methods which could let you to test a double strand break. For example, Coleman Access, they have this kind of solution, and some of the manufacturer, they are also develop this kind of test to do the double strand break.
Thank you. Maybe I may have to add on, if you cannot get a day 3 or day 5 embryo, we should not just focus on the male factor. It could be the
Yes,
oocyte
I think
factor.
yes,
Yeah.
I think female factors issue also need to be considered.
Yes. Yeah, there's this one. Okay. Can a frozen sample be used on a CA0 sperm separation device? Is it
Yes.
possible to put a CA0 sperm separation device in a room temperature rather than in incubator?
Okay. If you want to process the frozen sample, that is possible, because a lot of IVF lab, they want to process the frozen sample because if you put the sample into the refrigerator, you could increase the DFI value. So if you want to process this frozen sample, you need to defrozen sample first and then check if it could fit for our criteria. If yes, then you could use CA0 to process it. And according to our protocol, we recommend you to put the devices into the incubator. But as I know that some of the lab, they don't want to put the dishes into the incubator to affect the embryo. So yeah, of course, if you want to put the devices into the room temperature, it is possible, but only one factor will affect. That will be concentration. So if your sample concentration is good, you want to put into the room temperature, that should be fine. Or you want to do ICSI, so you only need to get few sperm selection, then you put into the room temperature. That is also possible.
I'm also interested to know, is the sperm separation device suitable for severe OATS patient? That means severe OATS.
Okay, severe OAT patient might be a big challenge, because our criteria is, if your concentration lower than 6 million per milliliter or total motility lower than 20%, that might be a very a big issue to select the sperm for conventional IVF. Or if your MSC multi-sperm concentration lower than 1.7 million per milliliter, that might be another challenge for ICSI surgery. And so if that belongs to severe OAT patients, that might be the limitation of CA0. But if that is for the mild or moderate OAT patients, that is suitable.
Thank you. This is a bit slight variation. What are the minimum parameter required for CAO? Oh, you have already answered that. Now, this second part is, can surgical retrieved sperm being processed be used in a CAO? That means those that we extract the sperm surgically.
What do you mean, Cisco?
Oh, okay. There are some of these male factor where they have azoospermia, where we have to extract the sperm through the scrotum. That means either through PESA, TESI. That means we surgically go into the seminiferous tubules and extract the sperm from there. Can this sperm be processed by your CA0?
Because our CA0 could only select the sperm with motility. So if you sperm from the test code, they still got the motility, that is possible. But the major issue is the concentration, is the number of the sperm count. If the number of the sperm count is lower, then that might be another issue. So if you check the sperm directly from the test code, if it still got the motility and you could get a lot of sperm count, that might be possible to select by our CA0. But if not, then that is impossible.
Yeah. A lot of time when we extract the sperm from through the testis surgically, the sperm usually are not motile.
Yes, yes.
Yeah. So maybe the answer more likely we will not be able to use a CAO. Out of interest, because you use the word C, A, and then 0. Why is such a name?
No, CA0 is just like the model name. That doesn't have any meaning of that. Yeah, it's just like the Mercedes-Benz, no, like BMW Q5 or X5. It's just like the model name. We don't have any special meaning, CAO.
I see. So probably you woke up in the middle of the night and suddenly the word came into your mind. Okay, the next one is any concern with contamination with CAO? If we were to separate the sperm and use it for IVF.
I don't think so. If you process the sperm by the standard procedure, then it won't have any contamination issues. But we usually found that they always forget to change the tip. So sometimes if you use the tip to apply the neat sample and then forget to change the tip and to use the same tip to apply the HTF, then that has some issues. So if you follow the standard procedures to process CA0, then you don't need to worry about the contamination issues.
Thank you. This is another one. This is something you didn't cover. Can process sample via Langshot CA0 be used with flushing media as alternative method for IUI?
Brush medium? What do you mean?
I believe this question, the question asked is whether this method can be, this CA0 can be used for IUI. That means processing the sperm for IUI.
Yes, CA0 could use for IUI, conventional IVF, and ICSI as well. So in some countries, they even use the CA0 specific for IUI because some of the gynecologists or general physician, they could do IUI directly. So they could use these kind of devices to process the sperm by themselves.
Okay, thank you. The next one, do you have any data or research papers supporting that the euploid embryo rate is higher when using CA0 sperm compared to when not using CA0 sperm? I think you have answered that. Maybe you can redo it.
Yes. I think that is not the formal publication, but they are working on the manuscript, and according to the publication, their finding of the experiments, like UCA0, they will get the high euploid rate compared with the direct swing up.
Thank you. Okay, there's this question that's asked. If the patient was diagnosed to have high sperm DFI, may I know any advice or treatment for patient, whether it's medical, injection, and can be done prior to this IVF treatment or ICSI?
Okay, so if the patient age is older, then the further treatment might be increase another age issues. So in that case, we will encourage you to use some non-centrifugation methods, just like CA0, to process the sperm to reduce the DFI value. However, if the couple, I mean the male or female, the age is still young, then you could try to refer the patients to andrology clinic to do the further treatment.
Yeah, from here, I think the patients will advise a lifestyle change.
Yeah, that's true.
When you say lifestyle change, well, it's healthy lifestyle. Okay, the next question is there any reason for the 30-minute incubation when 10 minutes is more than enough for a good sample?
Okay, because according to our experiments, if you put the devices into the incubator for 30 minutes, it will help you to get the maximum sperm. So if you put longer, then the concentration won't be increased. But if you put less than 30 minutes, then the concentration might be a little bit lower than 30 minutes. So the only fact is the concentration. So if you only want to put the devices into the incubator for 10 minutes, That is possible, but it will affect the concentration. So you need to check the sample status, or you need to check your ART protocol. If you only want to do the exceed, then that should be no problem.
Thank you, Cherry. I think we are coming to the close of this session. In fact, we run over time. And I, on behalf of MSART, would like to thank Cherry Yang for the nice and wonderful lecture in sharing this sperm DNA fragmentation. And after this, maybe, or I think I'm sure all of you, or at least I would want to consider a DFI as an alternative. Yeah. And also, I would like to thank the sponsor who have bring this esteemed lecturer to our this session. This LabIVF. Yeah. I believe LabIVF will be the person we may need to contact should we need these extra services. Is it true? And also, I would like to thank Amira, Radha, and the technical team for allowing this session to run through very smoothly. Yeah. And can we all thank Cherry Yang in the usual way?
Thank you. Thanks for everybody's time.
And lastly, for all the participants, it is very wonderful to have all of you here able to share whatever this Cherry Yang has delivered to us. Please fill up the post-webinar survey. Yeah. So from there, we can actually, for the next session, we can further improve our webinar. Thank you.
Thank you. And wish everybody have a wonderful night. And thank you, Dr. T. And thank you for everyone.
Thank you, Cherry, and everyone and all the participants.